This week we're talking about shin splints as it relates to the anterior tibialis muscle, but first, our disclaimer. Mike Matthews, physical therapist, here with the PT411. Thanks so much for joining me. If you already haven't done so, make sure you follow, like, subscribe, Facebook, YouTube, Instagram, TikTok, and Twitter. Also, make sure you check out thept411.com. So like I said, we're talking about shin splints, and shin splints is pretty much just a specific form of tendonitis down in our lower leg. We've talked about tendonitis in the past. As a quick refresher of tendonitis, it's when a tendon gets injured from being overloaded. If we remember what a tendon is, all of these individual muscle fibers here have little sheaths around them, little bits of soft tissue that surround each of them, and all those come together and keep going when the muscle belly ends, and all that forms a tendon. Now, typically speaking, we'll see something like this type of setup. You have a long muscle belly right here. You have your tendon coming off each end here. Whenever that muscle contracts in this way, it ends up moving one or both of the bones closer to each other. Now, it's a little bit different with the lower leg here. With the lower leg, it's not just going to be simply up here and down here with the tendon. The tendon is a lot more broad. It comes off fewer muscle fibers. So you're gonna see that entire tendon coming up and down, and to the most part, it'll be up there. Some of these come together and start to attach up a little bit higher here. Same thing on this other side. You have some that are attached down here, and a lot of these that come together that kind of attach in that area that goes there, but the same end result as this muscle right here contracts, all these little individual muscles contract here. What's going to happen is one or both of the bones are going to close in, close down this angle right here. But the same thing happens here. The tendon can get overloaded, and it'll either get overloaded by a single instance of a very high amount of volume or a lower volume at a repetitive rate, and over time this starts to fail, gets injured, and causes that tendonitis. And it's the same treatment principle regardless of if we're working on this side over here with the traditional set or down here with our shin splints. We always have to start off when we get this injury. We got to let inflammation take its run first. We allow that initial healing stage to start off there, and then after a few days we got to start loading it, and we have to load it within a Goldilocks zone. There's a specific Goldilocks zone in there where we have to load it up. If we do too little, we're just wasting our time. If we do a little too much, we're going to keep it injured. But there's a zone right in the middle there, and we have to listen to our symptoms to tell us if we're right in that zone or not. And the general rule of thumb is when we're loading it, it needs to be uncomfortable, it needs to be painful. It doesn't need to be excruciating, but it needs to be enough to let us know that we're doing something with it. We have to listen to our symptoms afterwards as well. We got to make sure that it lingers a little bit once we stop the activity, but it can't linger too long. We want it to linger about 3 to 5 minutes. If it lingers longer than 5 minutes, we're doing a little too much, and the next time we do the exercise, we need to back off a little bit. But on the other side of things, if we're producing no pain, or if the pain is very little and it doesn't linger on, we're definitely not doing enough, and the next time we do our exercise, we need to load it up a little bit more. So what we're going to do in this video is start off very light on how to load it, and we're going to slowly progress it going forward. The way to look at this is we want to start at that bottom level and we adjust accordingly. With some people, the injury might not be that bad and we can progress it pretty quickly to find our Goldilocks zone. Other people, we're going to have to start right at the beginning and very slowly creep it up, very slowly, try to increase that progress. And again, we're looking at our symptoms. So when we're going through this video, you slowly go up to find that Goldilocks zone and stick with it, and you wait until those symptoms start to go down, that pain is less and less, it stops lingering, and then we can progress it along a little bit at a time until we get to the point that it's not painful with our normal activities. But before we get started with that, I want to go over one thing real quick. There's a lot of research that really does suggest that having nice, strong, and stable hips actually directly affect how often that we get shin splints. If they're nice and strong and stable, they're normally not going to happen as often. If they're really weak, they're unstable, we're going to put a lot more force, a lot more stress throughout these muscles in our legs. So today we're looking at the tibialis anterior. We're going to take a look down here, and since we're talking about shin splints, you probably already guessed where this is. It's in the front of the shin right here. So you have all those muscle fibers coming down this way, turning in to the tendon that's broad that we were talking about earlier, crosses the ankle right here and attaches to that other side. So the actions here, primarily it dorsiflexes, it raises the foot up this way since it crosses over towards the inside here. It also, to an extent, controls inversion coming inward. So the big first thing that we want to do to load this up is we're going to work on actually stretching it. Before we even think about contracting that muscle, first thing to do is work on its extensibility, stress it out by doing that, keeping the contraction relatively out of it. So to do that, all you're going to do is put your foot down this way, put your toes down, and you're going to direct force going forward to elongate this entire section here to get a good stretch. So as far as the stretch goes, you're gonna hold this for 30 seconds. We're gonna do 3 sets of this, and we're gonna do this 3 times a day. So the second thing we're gonna do is get our bands back here and put that around this foot here. Make sure we have it going around the other side as well. This knee stays bent, other one is straight, and you're just pulling straight back this way. The good thing here, we're not using the full weight of our body to stress this out here, just using that band. We can stick with the same band for a long time. If it's real difficult, give it more slack. If it's real easy, we can always pick up the slack more and more to work on that right there. So now that we're working the contraction right here, changes it up a little bit. Now we're doing it for 30 repetitions, 3 times a day, and we're still minding our Goldilocks zone here. So to progress this further, we're gonna get back on our feet, making sure I'm staying in frame here, yep. So this time, with both of our feet down, heels nice and even with each other, we're just raising up and down on our toes. Same count, 30 times, 3 different times a day, minding our Goldilocks zone here. This gets easier. Our progression is going on to one leg, 30 reps, 3 times a day here as well. To progress that from there, we're actually gonna do some hill walking. We're gonna keep our heels on the ground and our toes up. We're just gonna walk around like this. We start off doing it for about 30 seconds at a time, work our way up to a minute or 2 at a time here. Progressing it further from there, we're gonna do more of a jog here. We can jog in place, we can jog back and forth, keeping those toes up to progress that load. Progressing it from there, we got to look at what our normal daily activities are like. We got to start mimicking those. Usually by about this time, that's about as much as we're going to load it up. But if we're doing something a little bit more demanding, we have a more demanding job, or we're in athletics, we need to start transitioning back into that. We go 100% back into it. Might not be the best thing ever. So we've got to start off probably about 25 to 33%, about 1/4 to 1/3 of our load. If that's fine, same thing with our Goldilocks zone. We start to progress it along, go to 50%, then about 66 to 75%, and then off to 100%. We're constantly trying to progress that. We're constantly listening to our symptoms, staying within that Goldilocks zone, so we're not wasting our time and we're not doing too much and keeping this thing injured as well. Next week, we're going to take a look at the other side of shin splints, our tibialis posterior, so make sure you stay tuned for that one. Again, I'm Dr. Mike Matthews with the PT411. Thanks for joining me.